Let's bring you back here to Lagos, where the health scheme is mandatory for all residents of the state. These included employees in the public and private sectors, self-employed and the unemployed. But the agency monitoring the scheme says only about 623,000 residents are enrolled under the scheme. What could be responsible for this glide? This report examines the business of healthcare in Lagos, how the state government hopes to provide affordable healthcare to residents and increase the number of enrollees. Ilera Eko reports.
With everyone talking about Sapa, a Nigerian slang which means a state of being extremely broke or poor, the hospital is the last place you would want to visit. In about a month, 27-year-old Esther has had to take her aging parents to the hospital, coughing out roughly 120,000 naira, a fee that is 30% less than a monthly salary. While her parents were in the hospital, she had to source for funds for their treatment at a private hospital, since public hospitals have recurring narratives, no bed space. Esther is one of the estimated 190 million Nigerians still paying out of their pocket to get healthcare services. Perhaps if she was under the health insurance scheme in Lagos, hospital fees will be one less thing to worry about. With the signing of the new National Health Insurance Act in May 2022, it's now left for states to domesticate the policy. Lagos, the center of excellence, is one of the few states in Nigeria striving to capture all residents under the health insurance scheme through the Lagos State Health Management Agency, Lashma. Through the scheme, people living in Lagos can be protected from financial distress resulting from huge medical bills. The scheme comprises three components. One, the Lagos State Health Plan, now rebranded as Ilera Eko. 2, the formal health plan being provided to public servants. And 3, the Lagos State Private Health Plan.
The Lagos State Health Management Agency has recorded some successes, one of which is the increased enrollment of residents in Lagos under the insurance scheme from an initial 5,000 to about 623,000. But when you look at the number, this number with the number of persons living in Lagos, you will know that that figure is still little. And the Lagos State is enjoining residents in Lagos to come on board and enjoy affordable health care.
You will never know when sickness will come, so you need to plan. You need to plan for it or put something away so that the day it happens, you don't have to be running helter-skelter to look for someone to borrow you money or loan, whatever, to sort out your family's needs. Standard plan is 8,500 for an individual per year and 40,000 for a family of 6.
For those in the informal sector or daily wage earners, you can join the scheme with the Ilera Eko Pay Small initiative by paying 1,000 naira or 3,500 naira for a family of 6 per month. This plan covers non-communicable diseases like hypertension, diabetes, malaria, minor surgeries, antenatal care, lab investigations, and medicines.
We know that in a social plan, it's not really about the margin of profit is not as high as people that would be in the private business. So you have to have some way that you support these people. So we're working on looking at things to do with drugs, which we know is a major cost element in the services that they provide, because we don't want that to fall. We are hoping to roll out something in that regard very soon, in the next 2 months.
Out of the 250 health facilities under this scheme, private hospitals form about 60% of that number. One of them is the Medin Specialist Hospital in Ogudu area of Lagos. As a healthcare provider, the hospital management believes the insurance scheme will give residents access to qualitative and affordable healthcare services.
Medical service is not cheap. Most of the people in the medical services they are specialized people, and they need to be paid very well. So the basic problem we have is that the amount that is being offered is considerably small compared with the services that is required. The Lagos State government have done considerably well in providing government hospitals. As far as Lagos State is concerned, it's a good start, but it's just the beginning.
I know that with what Lagos State have started, if they continue this way, they will make a very great impact in the society. Yes, by trying to go door-to-door campaign with this registration thing. Let everybody have access to care. Lagos State will do better, will do well too.
Although there might be complaints from healthcare providers and patients, the deployment of a customized app that will enable residents easy access to health insurance coverage. A 24-hour toll-free call center and USSD code might be the key to increasing the numbers.